Hey guys, Dr. Sean here. How you doing? We're going to have Happy Halloween. Gotta love that. So we're here. We're going to do our mailbag segment this morning. I got asked an interesting question. I said, Doc, what do you do for a chronic knee problem that just won't heal? I've done physical therapy. I've had some surgery done on it, which usually means that they've gone through and they've done orthoscopic or something of that nature. They've cleaned it up. They've got motion in the knee, but all kinds of pain and discomfort. Guys, you go back to the beginning. When you're looking at any chronic joint problem, you go back to the core of everything. Examine, examine, examine. One of the things we focus on in our practice is trying to figure out where the cause of the fire started. So you go back there, you look at the anatomy first. Always look at the pelvis and the hips, see what they're doing. Are they level? Are they unlevel? Are they rotated one way or another? Either way, it kind of gives you an idea. Then you go to the base. Look at the foundation. Look at the foot. Is there a problem with the foot turning in or out? Is there something abnormal in the foot? A bunion, a long second toe or a Morton's toe, a pronated ankle? You try to reestablish normal to the joints and the bones first. Then you look at the knee. Now once you go to the knee, there's not much to it really. It's pretty simple as far as bones and joints go. It's one big joint really basically, and you've got a tibia, a fibular head, and a femur that comes down, and a little tiny kneecap called a patella. Now, once all that's looked at, all right, they still got problems, still having trouble. Now you look at, all right, what holds the knee together? And more importantly, what holds the knee apart? See, muscles do both, and we forget that sometimes. We forget that muscles not only hold joints together, but they also keep them from getting too close together. They keep them apart a little bit. So you go through and we do MMR. It's muscle memory reintegration. You've got to teach the body how to turn and fire those muscles back on again. If you don't do that, you can never stabilize it. You can rehab till the cows come home, work your muscles, or do all those things. The problem is when you do that, the muscles have to be engaging. If the muscle gets to a certain point, a threshold, and it shuts down, you can't rehab it. Now all of a sudden you've got problems. The body can't turn that corner. So the work that we do, and it is very, very, very unique to our practice, you go through and you help the body to refire those muscles. You get them to re-engage. Now once the muscles re-engage, once you get it firing, it's instantaneous change. Instant. You can prove it, you can measure it instantly. Now that muscle can be rehabbed. Now that muscle can go through and do different therapies. Got to itch that nose. Now you can do all these things that are beneficial to the body. And if you do these things, you can turn the corner. If you do that, you can get normal function back. You get normal function back. You get the muscles supporting that knee joint again. And all of a sudden now the pain starts to come down. You can walk. You can get out of bed. You can get off the floor. You can get out of a chair without dying. If you do just those simple things, you can turn someone's life around, guys. This is what we do every day, and it makes it a lot of fun. So I hope that helps you in your mailbag question. I appreciate it, guys. Keep them coming. I'm Dr. Sean. Have a great, happy Halloween.